Plantar fasciitis or heel pain is an extraordinarily common complaint that I get. Typically, it's going to be in our older runners, occasionally in the college athlete, rarely in the high school athlete. It tends to be an overuse syndrome, age-related. So the plantar fascia is a thick fibrous band that helps your arch stay an arch. And so when you heel strike as a runner, you then have to go towards the ball of your foot. And that transfer of weight from the heel to the toe has to get distributed through that plantar fascia. So if you run thousands of miles, whether you accomplish that by 20 or whether you accomplish that by 50, sometimes that plantar fascia will wear out. Now a heavier runner is going to wear it out faster. A skinny runner probably not as fast. So there's a lot of variabilities about who gets it, when people get it, and then there's variations of it. Sometimes you can have an acute rupture of it where it's an actual tear, and some of my younger runners get that. When people get heel pain, there are many different ways to treat it. And the reason why is not one way works for everybody. What the evidence shows us is stretching of the plantar fascia is probably the most effective, but then you have different ways to stretch it. You have actual stretches, you have night splints. Then you can support the arch with, say, an orthotic or an over-the-counter arch support. That tissue is really dense. It doesn't have a good blood flow into it. If it had a lot of blood vessels in it, it wouldn't be as strong. And so the body sacrifices the blood flowing to it for more support. But then when it gets hurt, it doesn't like to heal. That's why it lasts for a long time. So there's tricks to try to get more blood flowing to it, like deep friction massage. Some tricks are to take a golf ball and just dig that sore spot into the golf ball to kind of bruise it. And it's like you're putting a new trauma on an overuse injury, but it's a way to get the blood and the healing to start. And then we employ our physical therapists to help us. Sometimes we'll do a cortisone injection, and very rarely it will need surgery.